Yes, and
thank you, Gahir. First of all, I'd like to thank the Minister for coming to the House today. And I'd also like to put on the record of the House my sincere thanks to the Minister for making the long trek from West Cork to North Mayo to Belmullet last Monday to engage with the staff and with the patients of Belmullet Hospital. They really found it a very fruitful experience, and I genuinely want to thank you for making the effort and for also recommending the preservation of the 20 acute beds in the hospital. I think it was an excellent decision, and thank you. I want to put in the record of the House my thanks for that. I was contacted, Minister, by Councillor Michael Sheehan from Wexford regarding the services, the reduction of services at New Houghton Hospital and other community hospitals. And I would like to ask what the government plans for the future of the district hospital network in the light of unprecedented overcrowding in the acute hospital sector. And we spoke about this the other day. But as I said, Councillor Sheehan contacted me with regards to New Houghton Hospital in New Ross, and it was a former fever hospital that has been lauded for its quality staff and delivery of care in the community. Over the last few years, it has become, like many other district hospitals, a care centre for dementia, Alzheimer patients and chronic illness patients. At its peak, New Houghton Hospital accommodated approximately 80 patients, but with the new HSE regulation and guidelines, it has been downsized to 50. However, over the past few months, I understand that the HSE has not allowed the admittance of any new patients, and there's currently around 30 patients there at presently, I understand. My understanding is also that there are a significant number of beds available in the hospital that could be used to alleviate and reduce the pressures in Wexford and Waterford, including other acute HSE hospitals. The staff have been recognised as doing an excellent job, but of course I would expect them to be worried for the future of the facility due to the fact that there is an inability to admit new patients. HICWA has noted the poor quality of the approach road and the immediate green areas around the hospital as a limiting capacity for the residents, but it also said that the care that was being delivered in the hospital was excellent. With HSE cuts to local facilities, I'm concerned that this hospital will be downgraded, and the public in the locality there are concerned of even a worse outcome, that it might eventually close. And this will be a devastating blow to many families in the locality, a blow to the employees and to the patients of New Houghton, especially after the local community raised much needed funds there through the Friends of New Houghton to provide extra services, equipment and amenities such as a sensory garden. The HSE have claimed that there is no demand for the 20 unoccupied beds. They claim that any demand for services has been met by private organisations locally. But as you know, Minister, and we spoke about this, why pay private facilities when HSE beds are available in the locality? It sounds suspiciously like maybe elderly health care might be privatised in this area. As you know, I've been speaking about the district hospital networks since I got elected to the Senate, and the Minister will know how passionate I am about them, that they are a vital role in delivery of a modern healthcare service in this country. And I think that any reduction to the services of New Houghton Hospital is counterintuitive, it's counterproductive, and it basically flies in the face of government policy. And as you know, Minister, the district hospital networks prevent admissions to the acute sector and facilitated discharges. And I think with appropriate investment, not a lot of investment, but appropriate investment, and the district hospital networks can really provide extra services, preventing people, especially elderly people, to have to travel long distances, often depending on a public transport system, which may be inadequate in certain parts of the country, or on a poor road network. I'm a little bit of lateral thinking, as I said to you on Monday, for example, you know, outreach clinics can happen and can occur in these facilities, for example, cardiac rehab and respiratory rehabilitation and stuff. So I'd just like to, I suppose, in summary, get an update with regards to the situation in New Houghton Hospital, and also maybe to see how you feel with regards to the expansion of the whole district hospital network nationally. Oireachtas.
And I'd like to thank Senator Swanick and for your comments at the outset there regarding the trip to Belmullet, and thank you for your welcome. And it's always nice to see a familiar and a friendly face when you go on a trip like that, and to meet a medical officer whom we're familiar with, so thank you for the welcome as well and the courtesy you showed to me on the visit there. Residential care is provided through a mix of public, voluntary and private provision. It is worth highlighting that the net budget for long-term residential care in 2019 is €985 million, and over 23,000 clients on average at any one time will be in receipt of financial support. Public residential care units such as Houghton Hospital in New Ross, County Wexford, are an essential part of our healthcare infrastructure. In total, they provide about 5,000 long-stay beds, amounting to approximately 20% of the total stock of nursing home beds nationally. There are also about 2,000 short-stay community public beds. The standard of care delivered to residents in these units is generally very high, but we recognise that many of our public units are housed in buildings that are less than ideal in the modern context. Without them, though, many older people would not have access to the care that they need. It is important, therefore, that we upgrade our public bed stock, and this is the aim of the 5-year capital investment programme for community nursing units, which was announced in 2016. This provides the framework to allow for an enhanced programme to replace, upgrade and refurbish these care facilities as appropriate. The Health Service Executive is responsible for the delivery of health and personal social services, including the facility at Houghton Hospital. HSE Community Health Organisation 5, which includes County Wexford, is committed to delivering services for older persons through a community-based approach that is supporting older people to live in their own homes and communities, and when needed in residential care centres such as Houghton Hospital. The hospital, which dates from the 1970s, is registered with the Health Information and Equality Authority as a residential long-stay unit with a maximum of 42 beds. Services provided include long-term care, dementia care, rehabilitation, convalescence, respite, palliative and end-of-life care. The HSE has informed the department that the hospital has an excellent reputation locally as a care facility, that the welfare of residents is a priority for staff and management, and that they are deeply appreciative of the support the hospital receives from families and the wider community. However, the HSE have also informed my department that demand for beds at the hospital has decreased, in part because of the availability of residential beds in new facilities in the New Ross area. I have requested more detailed information from the HSE in this regard so that my officials can properly evaluate the situation. I will be happy to update the House again in due course. In addition, the HSE has experienced challenges in recruiting and retaining required staffing. As a result, and to continue to provide quality care, while at the same time providing additional personal and communal space for residents in line with regulatory requirements, in recent months, the number of beds operational in the hospital has decreased to 31. In line with usual processes, the HSE will continue to review all its services to ensure the continued provision of high-quality, value-for-money residential care with the older person at the centre of decisions made.
Brief supplementary, Senator Swanick.
Thank you, Minister, for your comprehensive reply, and I'm somewhat heartened to see that you will maybe come back to us again with more updates, because, as you know yourself, it's an absolute nonsensical approach to take when the HSE pay a private facility for patients, and usually at a very high cost, when maybe there's an extra, as you say, 11 unfilled beds there in Houghton Hospital. And of course, families and patients and employees are very concerned, and local representatives. So I look forward to liaising with you in the coming weeks on this issue. Very Margaret.
Thank you, Senator. And